today I feel the most happiest, right? Because most of our work as a journal is almost 90% done.
Professor Alhaji Omar Njai marvels at work done at the end of a joint collaborative scientific writing and peer review workshop. The 5-day event, convened at the Lumley Atlantic Hotel in Freetown, was conducted by the National Public Health Agency in collaboration with the Field Epidemiology Network, or AFENET, the Sierra Leone Journal of Biomedical Research, or SLJBR, and the United States Centers for Disease Control and Prevention, or USCDC. The participants, comprising principal investigators and reviewers from academia, government ministries and agencies engaged in biomedical research, were capacitated with skills to enable them produce quality scientific articles for publication. The sessions were also designed to review submitted articles for consideration for upcoming editions of the journal.
What we've done here this week serves several purposes. One, we get publications from Sierra Leone. We're building your capacity to publish. The second, we are improving our reviewer pool. Our pool of reviewers is going to increase after this process.
Established in 2009, SLJBR is a publication of the College of Medicine and Allied Health Sciences of the University of Sierra Leone. It is the only accredited and peer-reviewed journal in the country. Njai is its managing editor. Observers say there has been a dearth in academic publication by Sierra Leoneans, notwithstanding the country being the subject of numerous researches featured in international journals, especially in the last decade following the 2014-2016 West African Ebola epidemic. And there are various reasons for this.
Over the years, we have not really got a reliable journal in Sierra Leone where they will know that Sierra Leone is cited. They will tell you that Sierra Leone, we have the highest IQ in Africa, but there's no education started in terms of Africa, but we have no journal here. So I think this was a very good move by the CDC, the AFENET, to work with Dr. Jai to have a Sierra Leone journal for which all of us should be contributing.
Professor Ronald Sulugu, head of Animal Science Department at Njala University, is one of very few experienced reviewers presently in the country.
Ebola, there's no Sierra Leone, anything on Ebola was Sierra Leone. I mean, few, but the majority are people that are not in this country. So if we have started with this and the procedure with AFENET and CDC supporting a local editor to collect information and publish our data, I think that is good.
Epidemiologist Binta Ba coordinates the AFENET-supported Frontline Field Epidemiology Training Program, or FETP, for the National Public Health Agency. She has a paper under review on a schistosomiasis outbreak in Koinadugu.
Sierra Leone, we have a lot of data, but writing and publication has not been a norm in Sierra Leone. And this is a very good opportunity for us to showcase what we are doing so far in the field of science and epidemiology in Sierra Leone. One of the challenges we face is time and also writing skills in Sierra Leone. You know, we know a lot, but putting it into pen and paper has been a challenge, and we've learned so much with the Field Epidemiology Training Program because it's an in-service and competency-based training where we've learned so much about putting what we've done into pen and paper. You know, in science they say what is not written is not done, and when you don't publish, you perish.
James Kobe is a data manager at AFENET. He is leading an investigation into data quality in assessing the enhancement of the electronic integrated disease surveillance and response system used by the Health Ministry.
Writing is a very challenging skills for especially Sierra Leone as a general, because we know even with our thesis and other stuff, it's very difficult for us to get a very good writing in terms of dissertation. So you moving from that angle, where in most cases you just find an art dissertation, probably a group dissertation, 4 people coming together to get one dissertation, and then you now being exposed in doing a actual writing, that's very challenging. And then timing in terms of competing activities. Imagine a situation where you have your office job to do and you are also being tasked to write a manuscript. So managing that time within the competing activities is very challenging.
Binta and James are among a crop of junior authors across the country represented here, whom Jai hopes will change this situation. They are all graduates of the FETP initiative, and there is only impressive improvement in local output following a series of such trainings that started in 2021 with the support of the US CDC.
Where we are now, I must say, is a long way from where we were, say, 10 years ago. When Ebola struck, there was little happening on research. So as a country, we saw very beautiful publications going out there, and the primary authors were not Sierra Leoneans. In fact, you could hardly see any Sierra Leonean in the list of authors. But with COVID-19, it changed thanks to the programs like the FETP program. And I know in any subsequent outbreaks or pandemics, we will have a lot of publications coming out of Sierra Leone.
Dr. Gebrekstos Negash Gebro, the head of AFENET in Sierra Leone and the resident advisor of the FETP initiative in the country, led the training sessions. He said his interaction with the participants proved that the country has a new generation of scientists who can do a thorough research and publish their work.
Sierra Leone has a new agency, the National Public Health Agency, and this is one of the core areas of the new agency to have a human resource for research and for public health system strengthening. So it's one of the core mandates of AFENET to deliver its mandate in Sierra Leone.
Like Dr. Jallo said, in Ebola times, all those papers came out. There's no Sierra Leoneans on those papers, even though they were doing a lot of the work. Not only to reflect that Sierra Leone has built its public health capacity, whether it's through FETP or other programs that not only CDC but other partners support. During COVID-19 times, we did not have a massive influx, thousands and thousands of international people coming in to do that work because Sierra Leone has the capacity to do that work itself. The same comes for scientific publications. You have to build that capacity to share that story yourself as well. We don't want you to be doing all of that work and then someone write up that work for you and someone else becoming immortal for the work that you did.